Hello, my name is Dr. Funda Goldman. I'm a licensed naturopathic physician, and today I was going to talk to you about Marma Therapy and specifically the Ayurvedic energy points on the chest. So, note of caution as always, the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. And it is always important to determine the root cause of any disease and to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective, and solo therapies may not be appropriate or effective in all cases. And especially since today we're talking about points on the chest, we're mostly talking about heart and lung function, you don't really want to mess around with that. So, Marma Therapy may be an adjunct or complementary therapy, but it may not always be on its own appropriate, safe, or effective. Okay. So just a few words about Marma Therapy. It comes from Ayurveda, the paradigm of medicine known as traditional Indian medicine. It's more than 5,000 years old, and it's a non-invasive therapy, so it doesn't use needles, it just uses touch. And Marma Therapy is considered an energy therapy. There are 107 Marma points on the body. And so when we talk about energy therapy or paradigms of energy medicine, in that paradigm, people, diseases, and states of health are looked at as energies or waves rather than sort of mechanistically. And so touch is used to allow energies to rebalance themselves. So especially if you come from a different background like chiropractic or physical therapy or even massage, you want to think about this therapy as more of a rebalancing of energy rather than if you push harder, you'll get a better effect. It doesn't really work that way. These points, especially around the heart and lungs, can be very sensitive, and so you want to use just gentle touch. You don't even necessarily want to push or press much, if at all. Okay. So if you're more interested in more history and background about Marma, I would look at my first Marma video, the Marma points on the hand. Or if you're just joining in, you might want to check out that video if you want to start at the beginning and go through the videos I've been creating on Marma Therapy. Also of interest may be my follow-along video on Marma points on the hand. That's a separate video where you can actually just follow along with me as I do a little session on the hands. And the other thing is, we're talking about pulmonary and cardiovascular health for the most part with these points. And so, again, I mentioned comprehensive treatment plan. So, actually yesterday I had a patient come in the office who apparently was told he had atrial fibrillation or AFib, but I didn't really see enough data or evidence of that from like lab reports or that sort of thing. So, I sent him out for more testing. His main symptom was palpitations, and so before I really went too far along in any sort of therapy, I wanted to make sure that I was treating the correct thing. So again, that goes along with determining the root cause, because other things such as like thyroid problems or blood sugar problems, diabetes, hypoglycemia, that sort of thing, or drug reactions, allergic responses, or recreational drug use, all those sorts of things can actually cause things like palpitations. So you want to make sure you've got the right root cause first. And the other thing is that when I see a lot of patients who come into my office, especially with cardiovascular health, some of them are already on 2, 3, 4 medications, and they still have things like high blood pressure. And so I also do nutritional therapy, and I did create this video called How to Do a Salt Inventory of Your Diet. And I find that very helpful. Because again, most people are on several medications and their blood pressures are still high, and so there's something else going on, beyond what the medications are addressing. And I find that especially most people don't realize they're taking in way, way too much salt. I mean, thousands of milligrams of salt a day, and so it's really counterproductive if they're trying to get their blood pressure down. So especially if somebody's at risk or has family history of stroke or kidney disease or just high blood pressure generally, cardiovascular health, heart failure. You always want to look at nutrition, especially salt. Also, I find with a lot of people who are coming in for cardiovascular with cardiovascular complaints, they really have a hard time relaxing and dealing with stress. They have a lot of stress in their life. And so I made another video called 20 Simple Natural Techniques for Stress, Anxiety, and Insomnia. So that might be of interest to you. And I also have a whole playlist. I'm also a certified yoga instructor, and I have a whole playlist on yoga meditation with several different meditations that people can utilize to, again, help them with the stress component. So again, you always want to, especially as a naturopath, you know, we're always thinking holistically, like what are the different types of therapies and comprehensive way we can help somebody on every level. So if you're interested in general about Marma Therapy and this sort of stuff, I would check out my playlist. I'm pretty good at organizing my videos into playlists, and I would check out the Marma Therapy playlist, the Ayurveda playlist, body care playlist, again, if this is of interest. So let's get into chest points. Well, before we get into chest points, let's get into chest anatomy and landmarks, because you're going to need those to find the points. So if we look at this individual here, right at the midline, that's what's called the sternum, and we have ribs coming off of that. And so you can see on this person, the clavicle is at the top part here, and that's what holds the what's called the shoulder girdle up. It kind of keeps your arms hanging off of your rib cage there. So the clavicle is very important, or sometimes it's called the collarbone as well. So that's an important landmark. And right below that, okay, you're going to start to see the ribs start to fold out from the sternum. And right below that, you're going to find the first intercostal space, and that's going to be the space between the ribs, and then you're going to go down 2, 3, 4, 5 like that. Okay, so just so you have like a picture of a human without all the arrows and the labels and stuff, because you have to find this on your own, and then just to see what's underneath so that you know what you're looking for. Because when you're palpating or trying to feel around for the points, you know, just understanding, you know, underneath the skin what's going on, you'll be able to, it'll make more sense to you, like, am I feeling a bone or am I feeling a space here? Because the bones will obviously will have no give and they'll be harder, that sort of thing. So just to kind of have this in your mind, you know, as we're going through. So how do you actually locate the chest landmarks that are going to be important here? So the first landmark is called the deltopectoral groove, and this is the angle between the shoulder and the collarbone or the clavicle. And if you move your shoulder forward a little bit, it helps to create or to visualize better the angle or the corner that kind of pops out there where that one finger is in the first picture in the upper left side. Okay, so you can feel in there, it creates, like when you pull the shoulder forward just a little bit, it creates this natural kind of pocket, and that's, again, going to be your first point. If you move to the second picture, so just slide over to the right on the top there. So if you have your finger on this first point in the deltopectoral groove, you take your second finger, put it on top of the first, and you're just going to slide it down and under the clavicle until you hit the sternum. Okay, this is going to be the first intercostal space, and this is going to be, again, important for locating the other points. Okay, and then if you move on to the third picture, so the lower left corner here, if you take a second finger from the second hand and you just go straight down, you're gonna ride over the top of a rib. It's gonna feel hard. It's gonna be a little bit convex, you know, a little bit of a curve there. And then after you go over the rib, you're gonna land in the second intercostal space. Okay, so we've got 3 landmarks here. This is gonna start you off with finding all the points. Okay, and then if you take these 2 fingers from the second hand that are in the first interchondral space and second interchondral space, if you move them down, just straight down, and you're going to ride over 2 ribs, Then you're going to be in the second intercostal space and third intercostal space. Okay, so again, we're going to start in the corner here, the deltopectoral groove, the oblique line between the shoulder and the clavicle. We're going to slide under the clavicle to find the first intercostal space, slide down, straight down for the second intercostal space, and slide down again, straight down for the third intercostal space. Okay, so that's going to be important. And also a little bit of a review of heart anatomy, because most of these points have to do with the heart, and it gets into quite a bit of detail related to the heart. So here we have a diagram, and blood is going to come back to the heart through the vena cava, the superior and inferior vena cava. It's going to come into the right atrium. It's going to go through the tricuspid valve into the right ventricle. It's going to go kind of back up and out through the pulmonary valve and the pulmonary artery back to the lungs to get oxygenated. And it's going to come back to the heart once it's been oxygenated through the pulmonary veins, and it's going to pool into the left atrium. That blood is going to go through the mitral valve into the left ventricle, and then the heart's going to pump it out through the aortic valve, through the big aorta, the biggest artery in the body, and that's going to pump blood, oxygenated blood, back out to the tissues, the peripheral body. Okay, so again, I just wanted to put this in here because we're going to use a lot of anatomical terms, and if you're not familiar with heart anatomy or you need to brush up, this should be helpful. So finally, the points. Okay, so the first point, I already showed you, demonstrated how to find it. Again, it's going to be in the deltopectoral groove in the first intercondral space. It's going to be 7 angular fingers from the sternum, so right in that corner up there between the deltopectoral groove under the clavicle. So the name of this point is called Skandadhara, or it's also called Kakshadhara. Skandadhara essentially means in Sanskrit that which holds the shoulder, and Kakshadhara actually can be translated as bridge, because it's the bridge between the thorax or the chest and the shoulder or arm. Okay, so it's a little bridge there. So the energies that this point regulates or balances are the pranavayu, the udanavayu, the vyanavayu, the sattaka pitta, the ranjaka pitta, and the avalambaka kapha. So these terms may not mean much to you. If you're a deeper student of Ayurveda, they'll be helpful. But essentially, these are more categories of energies in the body, because again, this is an energy paradigm that we're talking about. And just to give you an example of what these are about, like sattaka pitta, for example, this is the fiery energy of the mind. So this is because fire transforms, right? It can take a tree and burn it down into ash. So fire is a transformative energy, and what it does is this mental fire basically transforms all the sensory input through the eyes, nose, touch, everything, makes sense of it and makes decisions of it so that the organism can survive and thrive, hopefully. So that's just one example of what these energies mean. When you're starting out, you may not need them, but again, if you're a deeper student of Ayurveda, they should be helpful just to organize and categorize these points and what they're good for. So the indication for this point, again, all Marma points, as I've mentioned in all my videos, that Marma points all have local effects. So this particular point up in the corner here, it's helpful with the lungs, so general capacity and flow, chest pain, tightness, asthma, bronchospasm, pulmonary congestion, lymph node congestion, chronic cough, shortness of breath, bronchitis, pleuritic pain, and even the diaphragm. So basically the lungs and diaphragm here on almost every level, like whether it's a pitta, fiery, inflammatory type thing, or it's a kapha, earthy, congestive type thing, or if it's a vata, airy, asthma, bronchospasm type thing. So also because of the location here, it's good for the shoulder, arm, and even the hand, I would say. So it's good for shoulder pain, bursitis, adhesive capsulitis, so that whole shoulder area, the brachial plexus that runs down from the neck down the arm, tremors in the hand, because again, all those nerves are going to run through this area here. Forearm pain, cold hands, and neuropathy of the hands. This point can be helpful. And this point can also be helpful with breast concerns such as soreness and fibrocystic breasts. Okay, so local conditions here for Skandadara or Kakshadara, however you like to name it. The second point is called Apastamba, and that translates in Sanskrit to pillar, or that which supports or stabilizes. So the location of this point is one anguli or finger lateral to the midline of the sternum, and it's going to be in the second intercostal space. So again, you want to start off in the corner, at Kakshadara, slide another finger down and under the clavicle. That's going to be the first intercostal space, and then if you slide straight down lateral on the side of the sternum, you'll get to the second intercostal space, and you'll be at this point. So if you look at the photo here in the diagram, if you have all three fingers on your own chest, it'll be the second finger down on the second hand. Okay. So the energies invoked by this point are the pranavayu, the udanavayu, the vyanavayu, the sadhaka pitta, and the avalambaka kapha. Indications for this point include, again, lung function generally, respiration generally, asthma, bronchospasm, congestion, cough, shortness of breath, bronchitis, pleuritic pain, chest pain. So many conditions with the lungs. And here we're going to start, because we're getting closer to the heart, now we're going to start to affect heart function. So cardiac activity generally is helped by this point, arrhythmias, hypertension, and palpitations, for example. On the right side, and this is a pair, so you're going to have one apastamba point on the left of the sternum, and then the other apastamba point right of the sternum, in the same level, second intercostal space. So on the right side, that's more helpful for the aortic valve, the SA or sinoatrial node. That's the node that basically is the main initiator of electrical conduction through the heart. The right bronchus, and also just in general, the heart is considered the origin of emotion and thought in Ayurveda. So, a lot of these points too that are related to the heart actually help with the mind and emotions, which I'll get into a little bit more. But again, the right apastamba point. The left apastamba point is going to be the pulmonary valve in the left bronchus. So it just makes sense, right? The left point is going to be closer to the pulmonary valve and left bronchus. The right is going to be closer to the aortic valve, SA node, right bronchus. So that lays out like that. And again, mind and emotions. Again, in an Ayurvedic paradigm, mind and emotions really stem from the heart, and that's why we have so many quotes about the heart and listening to the heart, because that's where it may not always be rational, but it may actually get us closer to our own truth. And so working with this point can also help stabilize the mind and emotion and create more feelings of calm, peacefulness, and compassion. So the next set of points, there are going to be 3, and they're all called Hrid Marma or Marmani. Hrid means heart and in Sanskrit. And so there's 3 of these, and they're all pairs. So again, we have a right side and a left side to each one. And the way that you find them is that these are going to be even one more finger lateral to the apastamba point we just went through. So they're going to be a little bit more lateral to the sternum. They're not going to be up against the sternum. Maybe a little bit more lateral, a little bit wider in placement. And these are going to be at the 3rd, 4th, and 5th intercostal spaces. So again, 3 pairs going on here. And the energies balanced by this point are the pranavayu, the udanavayu, the vyanavayu, the sadhaka pitta, and the avalambaka kapha. Indications for this point, again, not just lungs, but general chest point. So pain and congestion, not necessarily cardiac related. So maybe if you have an acute infection, upper respiratory tract infections, for example, these can be helpful. But they do help the lungs. So asthma, chronic cough, dyspnea, or difficulty breathing. So heart function generally, heart rate, heart rhythm, so arrhythmias, coronary circulation, so just to make sure that the heart itself is well nourished by oxygenated blood, angina and palpitations, these sorts of things are helped by these 3 pairs of points. So there is a little bit of difference with the Hrid Marmani. So Hrid 1 is related to the bronchi, the pericardium, the myocardium, the aortic valve, so these are mostly more external structures to the heart. The right point, Hrid 1, is related to the right atrium and the aortic valve. The left point is related to left atrium and pericardium. Hrid 2 and 3 are related to the cardiac apex, so the little corner of the heart that's in the most lower, most lower left side of the heart. For most people, some people, their heart's in a different place, but for most of us, that's true. And this is related to the cardiac, as I mentioned, cardiac apex, the diaphragm, and the interventricular septum. So that's the wall or septum that goes up and down in the heart and divides off the right and left chambers. Yeah. And Hrid 2 on the right side is related to the right ventricle and the tricuspid valve. Hrid 2 on the left side is related to the left ventricle and the mitral valve. And Hrid 3 is related to the lower border of the heart. So now you know why I put in that picture, for reminding you of heart anatomy, in case you weren't really up on that. And again, these points are really important for balancing mind and emotion. So stress, processing feelings, developing compassion, love, devotion, and just general awareness, intelligence. Because again, awareness, intelligence, just being aware is important, so we don't lose sight of compassion and love and devotion and these kind of softer emotions. You know, we can a lot of times be too much in our head and override our heart, and Ayurveda would caution against that. So the 6th point here is called Hridayam, also translated as heart in Sanskrit. It's located on the midline of the sternum, in the 3rd intercostal space. So you can see here, it's like right where normally, it's almost like a reflex sometimes, you know, if you put your hand on your heart, or you feel something, or you just put your hand there. It's a natural thing. The energy supported by this point are the pranavayu, the udanavayu, the vyanavayu, the sadhaka pitta, the pachaka pitta, and the avalambaka kapha. Indications for this point include respiratory function, so not just the lungs, but also the esophagus, the trachea, the bronchi, asthma, chronic cough, and dyspnea. So it goes a little bit into the neck as well, probably because of its midline location. It also helps with heart, again, general function, rate, angina, palpitations, chest pain related to heart function, pericardium, the right side of the heart, so the atrium, ventricle, pericardium, interventricular septum, because again, the heart is skewed a little bit to the left, and so this Hridayam point, even though it's on the center of the sternum, it's actually over the right side of the heart more than left side. It's not in the center of the heart, it's in the center of the sternum. So that's why. And we're also getting closer to the upper GI and stomach, so there is some indication here for stomach issues such as acidity, peptic ulcers, gastritis, and reflux. And again, this point, being close to the center of the heart, is really important for the mind, emotions, and stress. And then the last point here is called Agrapatra, so which that translates to end of the leaf in Sanskrit. And you might remember Agra from my eye video. I mentioned what that means. It usually means outer point or last point. And so a lot of the points on the eye use Agra as part of the name. So, Anyway, the location of this point is right at the center of the xiphoid process, and that's the little tail right underneath the rib cage here. If you press on yourself just a little bit, you'll see there's like a hard little piece there, right below the rib cage. You don't want to press on this point too much, because if you press on it too much, you can actually break it off. And actually, if you do CPR, for example, this low, instead of in the middle of the chest where more hridayam is, you can actually break this point off, and it can lacerate organs. So be very careful. You don't want to do that to yourself or anybody else. So be careful here. It also tends to be a pretty sensitive point for people. So again, just gentle touch. Most of these marma points, again, you don't need to push or force or anything. Just laying your finger there with mindfulness. And again, most of these points, you just need to work with 30 to 60 seconds. It doesn't take much. So again, you need to shift. If you've been working in more of a mechanical type of field, you want to shift your mindset a little bit to really appreciate and work with the subtleties of this type of therapy. So this point is good for the lungs, general function, pleuritic pain, asthma, hiccups, and diaphragm, because it's pretty much over the diaphragm there. Heart function as well, heart rate, palpitations, arrhythmias, mitral valve, tricuspid valve, and the pericardium helped by this point. Upper GI stuff, so mostly stomach, but also getting a little bit lower. So nausea, vomiting, the esophageal orifice, stomach fundus, gastritis, reflux, peptic ulcer, duodenal ulcers. So again, we're getting into the small intestine here, and also loss of appetite. These sorts of things can be helped by this point. And again, mind and emotions. But the mind and emotions here are going to be mostly related to pitta or fiery type of emotions, like irritation, anger, rigidity, perfectionism, being over controlling of self or others. Because again, the energies supported by this point are the pranavayu, the udana vayu, the vyana vayu, the sadhaka pitta, and the pachaka pitta. So we're really right in the center of fire land here. So be mindful of that. And as always, I like to summarize the points, so we kind of go through one by one, and then we bring it all together, so a little time for integration here. And as always, as I mentioned, all marma points have local effects. So as you go through these, the only one of these 7 marma points that's related to the shoulder and arm is the one closest to shoulder and arm, so kakshadara, right in the corner between the shoulder and the clavicle. That's also good for some breast-related issues. All of these have some function related to the respiratory system, and to really understand which point's going to be best, I would look back at the previous slides to really figure out which ones are going to be most appropriate for a situation. Especially points 3 through 5, so the 3 pairs of hrid points, they're going to be generally good for chest pain and congestion, whether it's related to the lungs and or heart. So again, if you have like an upper respiratory tract infection, for example, or maybe you have muscular pain, costochondritis or something like that, like some irritation of the muscles between the ribs, those points can be helpful there. Most of the points, the best points for the heart are going to be 2 through 7, so everything close to the heart, the kakshadara point's a little bit out of range there. The best ones for the upper GI are going to be 6 and 7, so hridayam and agarapatra right in the center of the sternum, the midline of the sternum. And again, most of these points are going to be good for mind and emotions. Again, the kakshadara point up in the corner of the shoulder there is a little bit out of range, but the other ones all very much helpful with physical heart issues, as well as mental, emotional, and spiritual heart issues. So those are the points. Hopefully you found this helpful. And actually interesting to me, as I was walking around my neighborhood, I found this foxglove plant, so I took a picture. The Latin name for it is called Digitalis purpurea, and this is one of the old school plants that was used in naturopathic medicine for helping with heart function. And this plant is actually the origin of the commercial drug digoxin. So there are, modern conventional medications that originally derived from plants. Actually, quite a few. This is one of them. If you run across this, just admire its beauty. I wouldn't make it into medicine that you take because it can be toxic. So you want to avoid that. And it didn't seem appropriate to put in a picture of the Western heart-related herb without putting in a picture of the Ayurvedic, probably the most well-known Ayurvedic heart-related herb, or Arjuna, the Latin name of which is Terminalia Arjuna. And Arjun, if you've ever heard of it or heard of the Bhagavad Gita, that's a spiritual story about Arjun, who was an archer, famous archer, and he was in battle, and he loses heart. He loses courage, because actually on the other side, the people that he's battling are his family members and even his teacher. And so he's confused as what to do, and so he has a conversation with the divine about what is his duty. And the duty advises him to take heart, take courage, and do his duty. So a lot of lore, deep history. Again, Ayurveda just seems to have layer and layer and more layers of just deep wisdom and understanding. So I hope you found this helpful as we work our way through the Marma points. And I very much thank you for your time. Namaste. Take care. Until the next one.